My name is Larry Goldstein. I'm the chair of neurology at the University of Kentucky and the associate dean for clinical research. And I also was the chair of the writing committee for this scientific statement that focused on aggressive LDL lowering and its potential complications. My vice chair was Dr. Peter Toth.
Hi, I'm Peter Toth, and Director of Preventive Cardiology at the CGH Medical Center in Sterling, Illinois, and also Adjunct Professor of Medicine in the Division of Cardiology at the Johns Hopkins University School of Medicine.
We know that statins and other medications to lower cholesterol levels, lower lipid levels, have a dramatic impact in reducing the risk for cardiovascular disease in general, but cardiac disease and stroke in particular. But the problem is that these medications are not used as widely as they should be. One of the reasons for that is concern about potential side effects of lipid-lowering medications.
Yeah, so we know that LDL cholesterol management is an extremely important facet of risk reduction in the setting of atherosclerotic disease. And we have well-defined goals for LDL reduction for patients who are high and very high risk. And these goals are less than 70, less than 55. In Europe, if you have an event within 2 years of an incident event, they're now recommending an LDL of less than 40. Now, for some reason, these numbers make people a little nervous because there is this misconception that if you drive LDL, quote, too low, then you increase risk for dementia and possibly for hemorrhagic stroke. The only problem with this is they are misconceptions, and when you look carefully at the prospective randomized clinical trials, this concern really is not borne out.
So in primary prevention, folks who haven't had a stroke or myocardial infarction, there's virtually no evidence that lowering lipid levels, even to very low levels, increases the risk of brain hemorrhage. In patients who have had prior cerebrovascular disease, have had a prior stroke, the data is a little harder to work through because there is some evidence from smaller analyses of randomized trials that there may be a small increased risk of hemorrhage, although that also is debatable. However, I think the important point here is that even with that, the dramatic reduction in other vascular events way outweighs any small risk that may be associated with statins. The other lipid-lowering agents that are available, however, either added to statins or alone, don't further increase that risk.